Module 1. Structural Racism. Structural racism refers to the totality of ways in which societies foster racial discrimination through mutually reinforcing systems like housing, education, employment, earnings, benefits, credit, media, healthcare, and criminal justice. Conveyor belt analogy. If you stand still on a moving conveyor belt, you are still being moved in a specific direction. You don't have to be actively racist to participate in a system that produces racist outcomes. Redlining in Baltimore. Analyze how 1930s federal housing maps redlining denied mortgages to Black Marylanders. Today, those same redlined neighborhoods often have the highest rates of asthma, lead poisoning, and heat-related illness due to a lack of green space. Fact: race is a social construct, not a genetic one. The shift modern training requires moving from seeing race as a risk factor to seeing racism as a risk factor. Objective: to identify systemic choke points in patient care. Resource allocation. Why are the most advanced trauma centers or specialized DDA facilities often located far from the communities that need them most? Digital divide. As we move toward telehealth, how does the lack of broadband in certain Maryland zip codes act as a structural barrier to care? Insurance and credentialing. How narrow provider networks often exclude clinicians who serve marginalized communities, forcing patients to travel further for lower quality care. Module 4. Frontline Strategies for Equity. Objective: practical steps for providers to disrupt structural cycles. Structural vulnerability assessment. When a patient fails a treatment plan, look at the structure. Do they have a pharmacy within walking distance? Do they have a refrigerator for their meds? Language access DDA specific. For DDA patients, structural racism often appears as a lack of qualified translators who also understand disability-specific communication. Advocacy for proper translation is an anti-racist act. Data stewardship. Actively participating in the collection of real data, race, ethnicity, and language to help your facility identify where outcomes are slipping for specific groups. What is implicit bias? It is a brain shortcut. Our brains are like computers that automatically sort people into groups without us even thinking about it. Sometimes these shortcuts are wrong and make us treat people differently based on their race, age, or disability. 1. The pause button. In healthcare, we are often in a hurry. When we rush, our brain uses shortcuts biases. The goal: before you decide a patient is being difficult or doesn't care, take 5 seconds to breathe. Ask yourself, would I feel the same way if this patient looked like me or came from my neighborhood? 2. Labels versus actions. We often use labels that hurt patients of color or patients with disabilities. The label, "he is aggressive." This sounds like a person is bad. The action, "he is hitting the wall because he is frustrated." This sounds like a person needs help. Why it matters: patients of color are more likely to be restrained or given heavy medication because of labels, like drug abusers. 3. The same isn't always fair. Giving everyone the exact same thing isn't always fair. Example: if you have 2 patients and one speaks English and the other doesn't, giving them both an English pamphlet is the same, but it isn't fair. The fix: fair care means giving each person what they specifically need to be healthy. 4. You are the voice. Frontline workers spend the most time with patients. You see things the doctors miss. The problem: sometimes doctors don't listen to patients of color as much as they should. Your job: if you see your patient is in pain, speak up. Say, "I know this patient well, and this behavior isn't normal for them. we need to check for a physical problem. Summary for the break room. Check your gut. Your gut feeling is often just an old stereotype. Trust the facts instead. Be a learner. Every patient is the boss of their own life. Ask them what they need instead of guessing. Write it right. When you write notes, stick to what you saw, not what you felt.